These were the words of Sir Alexander Ogson, who, in 1882, discovered the Staphylococcus genus. Ogson discovered the bacteria after observing fluid from the skin abscesses of a man who had become infected after undergoing surgery. To test his theory that the staph bacteria were the cause of wound suppuration, or pus oozing, he injected the abscess fluid into guinea pigs. He observed that those that received the fluid developed similar abscesses, while those that received fluid that was treated with heat or acid did not develop an infection. Ogson's work paved the way for the practice of sterile technique in surgery and medicine. The use of antiseptics and eventually antibiotics made staph infections much more rare and certainly easier to treat. Like all tools, however, antibiotics have their limits. After years of widespread and haphazard distribution, antibiotics are becoming increasingly futile in the fight against the ever-changing genomes of infectious bacteria. Methicillin-resistant Staphylococcus aureus, or MRSA, seems to be leading the bacteria versus antibiotics arms race. Like most species of staph, Staph aureus is transferred by skin-to-skin contact.
Normally, the bacteria are happy to colonize the skin and live a peaceful existence there. The problem arises when Staph aureus is able to enter the body through wounds on the skin, after which it can wreak havoc almost anywhere in the body. In such a case, doctors could traditionally prescribe a routine course of antibiotics. Resistant staph that fails to diminish after a course of antibiotics is designated MRSA. The telltale sign of MRSA infection is a pus-filled wound at the site of entry that does not heal. As the infection progresses and enters the bloodstream, a patient may experience chest pain, cough, fatigue, rash, and fever. If it goes untreated, it can result in septic shock. These symptoms are more severe and progress faster in immunocompromised patients. Doctors can hold superficial infection at bay by draining skin abscesses before bacteria can make it into the bloodstream. Once that happens, however, a patient's only hope is to use more recently developed antibiotics that MRSA has not yet evolved resistance to. Given the increasing difficulty and limitations of antibiotic development, the greatest step in the battle against MRSA seems to be prevention.
Be cleaned, and an antiseptic and bandages should be regularly changed. Regular hand washing and general hygiene is essential. The medical field is taking further steps towards sterility and quarantine. In hospitals, where a rise of surgery-related infections are seen, the spread of MRSA is being prevented by isolating infected patients in private rooms whenever possible. Further stringency and attention is being paid to sterility, especially wearing gloves when coming in any contact with patients. Enhanced sterilization technology is being utilized to clean rooms before and after use. It often involves using UV radiation or some vapor disinfectant which is spread across the room, killing any stray germs, including MRSA. MRSA rates as a whole are increasing worldwide. Between the two types, hospital-acquired and community-acquired, the majority of infections are found to be hospital-acquired. It was discovered that 1 in 20 patients in hospitals are being treated for MRSA, and that on average the infection rate in hospitals were around 45%. Although the majority of infections are hospital-acquired, the rate of infection that occurs in hospitals is decreasing. As the infection rate in hospitals decreases, the rate of infection for community-acquired MRSA has steadily increased. While MRSA has a high infection rate, the death rate is relatively low. In 2002, it was estimated that 1.7 million people in the United States were infected with MRSA. Out of those 1.7 million infections, around 99,000 resulted in death. Annually, MRSA costs around $17 billion. Further research is in progress to help find ways to prevent the spread of antibiotic resistance by better understanding the mechanisms for drug resistance in bacteria. Some of the biggest players in the fight against drug-resistant bacteria include the National Institute of Allergy, Infection Diseases and the MRSA Research Center and the University of Chicago Medical Center.